Okay, well, look at this case. Okay, so as soon as you get the question, the first thing that you have to do, as I told you, is to go back to the to the last part of the question to find out why are you writing, to whom are you writing, who is the receiver of the letter, and those kind of things you need to keep in your mind and try to find out. Okay, so if you go directly
Yes.
to the last part, you will see that see it is written that it is referral to an ophthalmologist for further investigation and management. Okay, so that
Okay.
gives us an idea that we are talking about. This is a kind of referral letter where you are referring a patient um, to another health facility where he has to go and do some
Yes.
further evaluation and management. And then now, so maybe obviously you can understand that this letter is going to be read by an ophthalmologist. Okay, and
Okay.
speaking about what should be the content, it should give you a general idea that ophthalmologist would be, the person who is going to find out whether he would be
Yes.
interested in what happened to the patient first of all. Okay, he would be interested to know what was done for the patient till now and how his management progressed when he was with us, when he was in our facility. What were the things that were done to him during his presence in our institute or our facility. So that's what we are going to look into.
Yes.
Okay, so obviously we
Okay.
have to keep that thing in our mind and trying to make our this thing. So to get read through this question, we know that the name of the patient is Tej Singh. He is a 41-year-old person, and he has been a patient at the clinic you are working as a head nurse. Okay, so you know that this patient has been working in your has been admitted to your facility, and he's 41 years old, and you are the head nurse working in this particular clinic. Okay, then today's date is mentioned. You know that it's 31/1/2017. Okay, the name is mentioned, date of birth, address, medical history. So that thing you might have to read a little bit clearly to understand what happened to him. So he had
Okay.
hypothyroidism and thyroid replacement, no history of trauma, weight loss, hospitalized due to appendicitis in 2010. No other past history, no allergies, immunizations are current. Smoker, he smokes cigarettes and cigars. Then he's a teetotaler. Teetotaler, you know that it's a person who does not consume alcohol. So those kind of people are called
Okay.
as teetotalers. Okay, so he's a
Okay.
teetotaler here. Then a little bit social history is mentioned about the patient, saying that he is a system analyst. He arrived to Australia with his wife in 2012 as a permanent resident, lives in his home house. His wife, Mona, age 37, and he has one daughter. Okay, so some social history. Now, if we go to the next side, we have some dates mentioned. So on 10th, what happened is that
Yes.
is the subjective information was he presented with a headache, right-sided, no cough, no dizziness, no vomiting, and HA we can assume that it's headache accompanied
Okay.
with significant nasal discharge. Okay, so he had these kind of problems when he came in, and the objective data was that he was his pulse, blood pressure, and temperature, and everything looks normal,
Correct.
except the fact that temperature is slightly high, but not very important.
It's still in an
Yeah, neck was supple, alert, well nourished, well developed man. Okay, and then if we look at um, so there was a general assessment that was made for the patient, thinking that he was suffering from infectious sinusitis. Okay, so
okay.
because he had headache, and everything looked to be normal, so the assessment was for a general infectious sinusitis, and the plan was to he was given augmentin, amoxicillin, and all those medicines were given, and he was like discharged, I guess. Okay,
Okay.
then on 24th he represented, because we have a 10 to 24, we have a week gap, I guess. right?
Correct.
So
Okay.
this time when he came in, the subjective data was mm,
Severe headache.
uh, severe headache, right sided. This was, and this was, um, uh, you know, then he had throbbing, radiating, right, throbbing headache. This headache was like this. Last time it was
Yes.
not throbbing, This time his
Correct. Now
headache,
it's
uh,
severe.
yeah, severe. It is radiating to right eye, teeth, and jaw, and it is lasting for 15 minutes to less than 2 hours. Okay. Um, okay. Then what happened is that then it was persistent. Okay. Then headache intermittent episodes. Patient describes pain as um, pain as what so like someone has put red poker into my head. So I think the pain score is mentioned. Pain score is
Oh,
10 out of 10, unable to stand. So
okay.
now this time his pain is like an episodic, and this
Three.
pain is like getting dangerous. Okay, so it is
Mm-hmm.
important that um, we have to you have to understand that the symptoms have to be explained properly in our writing. So it is important that we understand the symptoms
Correct.
properly. Okay, because we may when we are referring it to the ophthalmologist, we have to explain all these things, I guess. Okay,
And the
then
difference during the initial visit and then the next visit.
exactly, exactly. Because his the content of this letter will be how you describe the symptoms for the this ophthalmologist. Okay, so
Yeah.
then he was sit down or go to bed. No effect when light and noise. Avoided rhinorrhea, no nausea, vomiting. So no excessive drainage from the nose, or no other vomiting, nothing, nausea, nothing. Okay, then
Okay.
pulse rate is 105, slightly. BP is
Now it's
slightly
increased.
elevated.
Yeah.
Yeah, and physical and neuro exam normal, neck tender, right side no. And this time another assessment was made that it was cluster headache, and let's see what was done for him. And he was given acetaminophen and non-steroidal anti-inflammatory medications. Okay, then
Mm-hmm.
so the first time, so if we
After
if we
OET.
go through this information, we know that the first time we thought that it was infectious sinusitis and he was given augmentin. The second time we assumed that it might be cluster headache, and he was prescribed acetaminophen and non-steroidal anti-inflammatory medications. Then on 29, he presented again. Okay, this time a patient accompanied by wife. Okay, this time his wife also came in. Her name is Mona, and they complained of previous complaints of headaches occurring in episodic attacks with rhinorrhea and epiphora. So now excessive running of
Mostly.
nose and watering of eye was there. Epiphora, running of nose, and epiphora means watering of eye, and rhinorrhea means watering or excessive drainage from the nose. So this was
Okay.
an extra thing that was there. Okay, then right eye appeared to be droopy. Okay, and sometimes sunken eyelids. And this was first noted by his wife Mona one day ago, and the person had facial flushing before and during the headache. That was also noted. Okay, and then apart from what they described, we also observed that his right eye and upper eyelid were drooping, constriction of pupil in dark lighting, decreased sweating on the right side of the face. Pulse was 95 and BP was 130 by 85, almost elevated. So this time we thought that it is the person has a possibility of Horner syndrome. Okay, so we thought that it might be Horner syndrome, and now we are referring this patient to ophthalmologist for further evaluation and management for that particular condition. Maybe we assume that he might be having this kind of problem. Okay, okay, did you understand this?
Yeah, yeah, yeah.
Yeah. So what do you think might be the thing that you have to do there?
Um, since what I think
Mm,
is from the initial assessment,
mm,
see, there's no exact or concrete, diagnosis for the
so
patient's condition, which is very important since like different medications were already given because of the pain and it's still there.
yeah,
So most likely they wanted the ophthalmologist is the right person to give the proper diagnosis and treatment plan, of course,
exactly. So here
after the.
we understood that this person is. So if we just summarize what happened with this
Mm.
patient, we will just know that like initially when he came with complaints of normal headache and all those things,
Yeah,
and on
correct.
10th he came, and he had these kind of right-sided slight headache,
Yes,
and
but
everything
not
seems
the
to be
severe
normal,
one.
not a severe one. Everything seems to be
Correct.
normal, and we thought that it might be infectious sinusitis, and he was start treated with augmentin.
True.
Then he
And then
represented,
after that,
and this time his headache, the symptoms of headache
severe.
slightly become severe. Like this time, I think he reported that it is throbbing, and it is radiating
Yeah,
to right eye, teeth, jaw, and now he talked about the duration that it was like almost for 15 minutes to 2 hours. Then
the pain level is very high now.
pain level is 10 out of 10. So I think
Yeah, it's
he's reporting
extremely
that it's extremely painful for him. Okay,
correct.
so that was another thing. And this time we thought that it was cluster headache that was causing this problem, and we prescribed in acetaminophen and non-steroidal anti-inflammatory medications, right?
Yes.
Okay, what so then what happened after that?
And then after that, now another symptoms were
He
revealed
represented,
on
and
him.
this time, he came in
Yeah,
with his wife, and there are certain things his wife is reporting. There are certain things that we
yeah,
found
which
out,
are new
yeah,
to
which are
new
new. So
symptoms appeared.
if you look at the symptoms, you'll understand that this time epiphora and rhinorrhea were the things that were, diagnosed extra. Okay,
True. And then the
and we also
droopy
noticed that
eyes.
eyes were droopy and sunken, and these kind of
Correct.
things were there. Thank you. Okay, and then
So here, somehow the assessment they have given a possible, you know, condition, and
condition,
I think
yes.
we just need to reconfirm it to the ophthalmologist.
Yeah, ophthalmologist has to
Correct.
basically confirm if this condition is what exactly what the person is talking, or
Correct.
the so these are the things that he has to mainly do. So then we think that we assume that it is it's a condition of Horner syndrome, and we are
Harness
planning to
syndrome.
do it. Yeah, that's the question here. Okay.
Okay.
So
Okay.
now, if we try to write this question, we know that we need to again have this kind of structure. We'll start by the date, which is already mentioned in the letter. So today's date is mentioned, see, right? So today's date is
Ah, yeah.
31 1
It's there.
2017. So we just start by writing the date. Again, as I've told you, that it's not important that you have to write your dates in the first. You can still write it after the address also. It is totally your personal discretion whether you want to start it by writing the
Yeah,
receiver's
that's
address
right.
first and then you write the date, or if you want to write your dates first and then write the receiver's address, it's totally up to you. It's your personal choice. Okay,
No
so
problem.
then comes your receiver's
Mm.
address, which is also not present in the question which I showed you, but it will always be there in the question, so you need to ensure that you write it properly.
Mm.
Then you have the regarding subject line where you are mentioning the name of the patient and the date of
Yes,
birth
the
and
date
all
of
those
birth.
things. Yeah. Then we are referring
Okay,
salutation.
and
We
then
just talk dear Dr. Dyer. Okay.
okay.
So that's what this one looks like. Okay. So
This should
now
be the
this
things that should be
this
there.
should be the. So now I think I've told you that now the first paragraph that you're going to put in should talk about the purpose of the letter. Okay, that means the reader should read that particular paragraph and understand why are we writing this letter. Okay, so we know that we are writing this letter for further evaluation and management, And we also know that he may be suffering from Horner syndrome.
Horner
So,
syndrome.
yeah, so we need to mention these factors into our purpose, saying that I am writing this letter for this particular person who might be suffering from um, Horner syndrome, and the ophthalmologist, has to, do the further evaluation and management for that patient. Yeah,
Okay.
right. So see, look at this. So if you look at the starting, I am writing to request an assessment and further management of Mr. Randhawa, who is presenting with signs and symptoms consistent with owner syndrome. So this is a way to write that we are talking about a patient who is presenting signs and symptoms consistent with owner syndrome. This patient's symptoms um, are indicating that the person has owner syndrome. But for them, for him, you have to the ophthalmologist has to perform further assessment and management. Okay, then we describe his symptoms and how, the way he came in and what was done for the patient and all those stuff. So initially he presented to us on this date, complaining of rhinorrhea and headache. So in the initial present, he was like, he was reporting of excessive this thing. See, let's see.
Headache.
See, dizziness, denied vomiting, significant nasal discharge was already there. So he presented with headache and rhinorrhea. So these were the two things that he
Okay.
presented initially. So we write that he presented with complaint of headache,
Rhinorrhea and
rhinorrhea.
headache.
At the time, it was suspected that sinus pressure was causing the headache,
Correct.
and
Okay. And he
consequently,
was
as
treated for infectious sinusitis.
yeah, as a consequence to this, he was treated for infectious sinusitis. Okay, so this was something that was done when he came first. Okay, so
The
then
summary of the initial assessment.
visit, yeah, the summary of the
Okay.
initial visit of the patient. Okay, so now if we know, then and we have to write it in past tense mainly because it is something that we
Yes,
are talking
correct.
about a particular date, so we have to keep in mind. Then we still further describe what happened to him and how was he treated. He returned 2 weeks later with deteriorating symptoms. At this subsequent visit, he complained of excruciating right-sided throbbing headaches that occurred intermittently and did not subside despite attempts to rest. So that's the statement that tells him that tells the ophthalmologist that he came in again, and this time his symptoms were deteriorating, and it was excruciating. That means it was extremely painful. It was right sided. It was throbbing, and it was episodic. Actually, that's what you mean by occurred intermittently, and did not subside even he tried to rest. Okay. Additionally, he reported of concurrent and previously described rhinorrhea, and a diagnosis of a cluster headache was made. This time it was diagnosed to have the cluster headache, and the patient was prescribed acetaminophen and non-steroidal anti-inflammatory medication. So we just described both the visits. Hmm?
Yeah. Sorry.
We described both the visits for him. Okay, so that.
Yes, you described both visits, and then I noticed in the last
Mhm.
sentences you mentioned the diagnosis and then the medication prescribed. Or
Yes. Yeah, well, because it was not the true diagnosis, because we just
true.
yeah, like, even though we thought that it was a cluster headache, but he presented again.
Still,
So
it
on
has to be mentioned.
it has to be mentioned though. So then on
Okay.
his last visit 2 days ago, he presented along with his wife, who noted that his right eye, ipsilateral to headache, seemed droopy and sunken, exactly how his wife reported, and his face
Good.
flushed preceding and during the headaches. That means before the headache and after the headaches, his face flushed. And in addition to that, pupils of his right eye constricted in darkness, and he had decreased sweating on the right side of his face. So you can say that this was another extra symptom That was not there in his previous visit, and this time he had all these kind of symptoms. So
Yes.
simply, we just end the letter by saying that given the above, it would be greatly appreciated if you could assess, examine, and treat the patient as deemed appropriate. That means, as you think is correct, you have to just assess, examine, and treat. Please contact me in case of any questions, and you just finish the letter. Simple as that,
Okay. Okay.
right? I will give you another suggestive answer. See, like this will tell you how to make that sentence, okay, or make that information again. See, I am referring the above caption instead of above caption patient. You can this is not something that you should be using because of the fact that you should write the patient's name instead of
On the letter itself.
yeah. So you can say I am referring Mr. Randhawa, who is demonstrating or who is presenting or who is manifesting or who is exhibiting signs and symptoms which is suggestive of, indicative of, consistent with owner syndrome. Any of these things you can, make sentence with. Okay.
Okay.
Mr. Randhawa has attended our clinic thrice over the past 3 weeks, during which time he had several episodes of right-sided headache. So we are just, giving a summary of his visits by saying that he visited multiple times, and during all these times he had multiple episodes. Yeah. Then
Sided headache.
yeah, then we just try to present one by one what was it he presented on
So they
um,
should be avoided.
which one.
Uh, this type of sentences or descriptions.
No,
You're
it's
saying
okay,
it
you
should be
can, yeah.
avoided.
See, what I meant to say here is that you have all the liberty to
Ah,
write
okay,
it
okay.
any way that you, but as long as you are conveying the message clearly,
The-
you shouldn't be following any kind
mm,
of particular format, or you shouldn't be sticking to any
mm,
particular way of writing. Okay,
okay.
you should have that freedom to choose what you want to, like how you want to present or describe, or what kind of sentences, what kind of verbs you are planning to use into your words, into your
Yeah,
letter. But as long as you are conveying the message in a
yeah.
professional manner,
It's not an
it looks
issue.
good. Yeah. So
Okay.
then we say that he presented on this date with complaints of headaches and rhinorrhea. On that day, he was prescribed augmentin based on a diagnosis of infectious sinusitis. So um, we described the first visit in that line in a different way.
Correct.
He returned 2 weeks later with complaints of right-sided throbbing headaches, which occurred periodically. And this time we just talk about his episodic attacks and were not relieved by rest. Additionally, rhinorrhea had persisted and headaches were accompanied by aching teeth. The symptoms were suggestive of cluster headache. Consequently, he was commenced on acetaminophen and non-steroidal anti-inflammatory medications. 2 days ago, accompanied by his wife, he presented again as his right side, his right eye seemed droopy and sunken. Moreover, his wife reported that his face flushed before and during the headaches. An examination that day revealed decreased sweating on the right side of the face, and his right pupil constricted in
People
darkness.
constricted lungs.
Given the above, it would be greatly appreciated if you could assess, examine, and treat the patient as deemed appropriate. Please contact me for any questions. Did you get this?
Yeah.
Yeah.
What's important here is, you gave brief and complete summary of each visits, which is easier for the reader to understand what
Yeah.
happened.
See, it's in the marking criteria, they have defined it as a writing an effective summary. Effective summary actually
Correct.
means, not going with all the specific details, but still
Yeah.
you give an effective summary of what is happening or what was done to the patient, and all the information that you're writing should be only
Yeah.
those things that are necessary for the reader. You're not including anything that is not needed or not required for the patient, and things are not required for the ophthalmologist to know. Like we know that we there were a lot of medical history and
And the
social
social,
histories and all those things.
background and all.
So it's obvious that those
Because
information are,
mainly the request is to reconfirm the diagnosis, which is
yeah. So all these medical history and social
yeah.
history may not be
Okay.
important at all in this particular case.
True.
So that's what
Okay.
the marking criteria suggests, that you have to be selective with what information you are including, and you have to organize it. We know that we organized it in a chronological order, um, starting from what was starting from the
Yes.
date when he presented, um, till the last day when
Correct.
he came in. What were the progress and what was,
And then the second visit and then the last.
yeah, did you get that point? So that is how we have to go about
Yes.
writing this particular letter. So what I will do now is that, did you get an overall idea about what is happening with this letter?
Yes, of course. Since it is being sent to another healthcare, professional,
So
then this has to be the way.
yeah, so in
But for sure, if it's a different person, this different recipient, it'll be different.
exactly, that's what I wanted to make at a point here, that sometimes you may get
Yeah.
referral letters. Maybe referral letters usually come in, but the fact is that you have to first confirm if you actually know the diagnosis or not. Okay, and then
Yeah.
you have to consider the person who is receiving the referral, and you have to think what information
True.
might be useful for him,
Mm-hmm.
and you have to be very selective with informations. And then it's good to describe it in a
Mm.
chronological order. Okay, if a certain thing happened, because we know that this
Yeah.
diagnosis has not yet been confirmed. So uh, this this gives us, this points towards the fact that we have to describe his previous symptoms, so that the person who is going to confirm the
Mm.
diagnosis should have all those information. But again, we did not
Yeah.
talk about his pulse rate, and we did not talk about his vital signs and all those things. Why do you think we did not talk about that?
Because during, like for example, these can change anytime. I mean,
Yeah,
at the time of
exactly.
the
That's what the point
visit.
is.
And if ever he will be seen by the doctor, then they can just, which are the vital signs can always be checked.
Yes, that's the point here, because
These are, yeah,
it could be an outdated information for the ophthalmologist to know that
true.
his pulse was, it could be an
It
outdated information.
varies.
So you don't need to
True.
include
Mhm.
any such kind of information which you think might be outdated also, because there may be a lot of information that may not apply to the current situation, just like in pulse
Correct.
rate and in blood pressure. And we know that there was like certain variations in the blood pressures, and it was not so so big variations that we had to write it anyway. But the symptoms were more important than writing about the small variations in the blood pressure
Right.
that he had. And obviously
Okay.
we can understand that these things were not so prominent to be as a reason
Mm-hmm.
for his headache. So again, then
True.
we just
Unless the diagnosis is hypertension, then of
yeah,
course.
if the diagnosis is hypertension, then we might have to include this. Very good, you understood that.
Correct.
Yeah, so this is basically the judgment of a nurse to decide what information might have to be included, what has to be
Mm,
avoided,
correct.
and how to frame your letter in such a way that it is useful for ophthalmologists,
Yeah.
and how to write
Like
all
what
this.
you have said, effective summary of the
Effective summary of the
condition.